The impact of good nutrition on breast cancer. Your risk of developing breast cancer might be 1 in 9. However, it may be higher or lower depending on additional risk factors. It is important to know the factors that can drive your risk for the disease higher and the screening tests that are used to find it. Some of the most notable of the risk factors for breast cancer include having a personal history of the disease or family history, higher risk from maternal family members, an early onset of menstruation as well as a late cessation of the same, a late-in-life first pregnancy or having never had a child, hormone replacement therapy, excessive alcohol use, some dietary factors, smoking or exposure to second-hand smoke. There are a number of tests that should be done in the case of suspected breast cancer, including a breast ultrasound. This is a better testing method than the traditional mammography, which may miss small tumors or precancerous cells in those who have very dense breast tissue. Breast cancer is a very treatable disease if found early, with over 80% of all breast cancers found by the women themselves during their own monthly self-breast exams. It is for this reason that the breast self-exam should be done every single month and done correctly. The doctor will show you how to check every inch of your breast as well as the area under the armpits and will also tell you what to look for. These warning signs can include a change in the nipple's appearance, including a strange discharge, scaling or crusting, changes in the shape or contour of the breast, a lump, mass or thickening, or any major change in the appearance of the breasts at all. Because many women have a condition called polycystic breasts, or lumpy-feeling breast tissue, it is important for the woman to know what is normal for her own breasts. In addition to self-exams, women should have a mammogram or ultrasound at regular intervals established by her age and her risk factors. If either of these tests reveal a lump or a mass, further testing will be ordered. If the doctor cannot make a clear, definitive diagnosis, the mass may be subjected to a needle aspiration. During this procedure, a small needle is guided into the mass with some cells or fluid drawn out. If it is only a breast cyst, it will collapse when the needle is removed while a mass will not. The cells or fluid is used for diagnosis by the doctor. If the doctor cannot get a clear diagnosis or there were not enough cells for proper examination, the doctor will suggest a biopsy where a small cone of the mass is removed and then dissected. After a complete diagnosis is done, the doctor will be able to tell whether it is cancer and if it is, what stage it is in. This is necessary to determine the treatment plans and options for the patient. Why nutrition is vital at this point. While the body is dealing with the breast cancer and its subsequent treatments, it is vitally important to get the right nutrition. Not only should the diet be high in fresh fruits and vegetables, but it should also have a high amount of protein. Because many cancer patients find themselves unable to eat well, they may have to get additional nutrients from supplemental forms. ProfectR from Protica can be perfect because it can be consumed in mere seconds but still provides a good amount of highly digestible protein. Available in a number of different flavors, ProfectR can also be mixed with other foods and beverages as needed. During some cancer treatments, nausea and vomiting are common and make it difficult to get enough nutrients. Protein is important to protect and restore the immune system and necessary to fight off infections. Protein is also important to help the body restore its structure. Because breast cancer treatment may also require surgery, it is even more important to have the right nutrients, including protein, to be strong enough to face the surgery itself and the recovery period. Breast cancer and nutrition, a case study. Laura is a 38-year-old woman who has just found out that she has breast cancer. She had always been very good about her breast self-exams and has never missed a single doctor's checkup. One day, while doing her breast exam, she found a small lump. She called and made a doctor's appointment and then nervously waited for the day to arrive. She had a mammogram which was unfortunately inconclusive. She was then scheduled for a biopsy which revealed that she has stage 2 breast cancer. The treatment plan that her oncologist has come up with includes chemotherapy in several stages, a brief round of radiation therapy, and then surgery. At this point of her breast cancer, Laura's doctor is not sure whether or not she will need to have her breast removed or not. To keep her strength up, Laura is trying to focus on her nutrition, including getting enough protein and iron. After her second round of chemotherapy, Laura has found that she is anemic and will not be able to continue with her treatment if she does not get blood products. After 2 units of blood, she is given her next treatment and will continue to try to eat nutritious foods. Unfortunately, she doesn't like the taste of meat, which is one of the best sources of protein. She is able to use ProfectR, so her protein intake can remain at least moderately high. In addition to her nutritious diet, she is going to focus on positive attitude and living her life the best way that she possibly can, focusing on the good and trying to minimize the bad.